All right, today we're going to talk about the drain that you may have been sent home with, as well as how to flush the drain and take care of the drain with some supplies at the insertion site. The first thing we're going to talk about is the actual drain itself. This bulb here is what we call a JP drain, and it consists of 4 parts: the bulb, the tubing, the stopcock or locking device, and the catheter that goes into your body. The first thing we want to talk about is the stopcock. So the stopcock is when in this position that's perpendicular to the tube, this is off. To open up the stopcock, we put it parallel to the tube, this is on. This is important when flushing and removing the tubing so that the flush will go in appropriately and not spill on you while you are accessing the tube. On the JP bulb, there are markings on the side from 25, 50, 75 to 100. This correlates with cc's or milliliters and can tell you how much has come out per day in your bulb. We typically like to record these outputs once every 24 hours, and we'll have you empty out the bulb once every 24 hours after you have recorded your output on a piece of paper and kept a chart. Some of the drains may come with a different type of stopcock device, which is called a 3-way stopcock. If you have one of these, we will go over how to flush that one as well, but essentially works in the same way. Some of your stopcocks may also come with a red cap as opposed to a blue cap. When we send you home with a drain, something that we may ask you to do, depending on the type of drain you have, will be to flush it 1 to 2 times per day. Please read your discharge instructions as to whether you are flushing once a day, twice a day, and with how much. In your bag, you will see a flush. The flush is 10 cc's of normal saline and is safe to put into your body. In order to flush, please remove the white cap by twisting it off. If there is some air in the tube, gently remove the air by pushing up on the syringe. In order to flush the tube, you're going to put the stopcock in the off position. This will turn off any fluid from here to there. Next, you will unscrew this white cap to release the JP bulb. Please connect the syringe and open up the tube to allow for a smooth flush. When you're flushing, please flush slowly, as it may be painful if you go quickly. And please pay attention to if you're supposed to be flushing 10 versus 5 cc's of fluid. This will also be in your discharge paperwork or will have been discussed with you upon discharge. Once you are finished flushing, please remember to turn the stopcock to the off position, unscrew the syringe, and dispose of it. You will then reconnect your tube to the stopcock, open it back up to allow for drainage. You may notice that after you have flushed, your bulb is now big and open. We want to make sure that this is compressed. In order to compress it, please remove the top, squeeze gently, hold that squeeze while you place that on top. In order to check if the suction is good, the bulb should not reinflate once you're done. If you went home with a 3-way stopcock, this is typically what it looks like. It functions the same way as a 2-way stopcock. The only difference is that you do not need to disconnect the tubing from this point, as you have an access point right here. In order to flush a 3-way stopcock, we want to turn this lever towards the tube. You will also notice that it says off on the handle itself as a good reminder to which position is off. Once that is off, you will go ahead and take your flush, unscrew this blue cap, remove any air, and go ahead and screw on. You will then gently flush, keeping this in the off position as we want the fluid to go into your body, paying attention to whether you're flushing 10 cc's or 5 cc's. Once you are done, please remove and dispose of the syringe. If you have a blue cup, please put it back on once you're done flushing. Or if you have a red cap, it will go on the same way as so. Once you are done flushing, please remember to turn the off position back to the port that you just flushed through. Otherwise, you will continue to keep this off and the fluid will not be able to be drained. Typically with three-way stopcocks, they will not allow air to escape from the bulb. If you did not go home with a bulb, you may have gone home with a drainage bag which holds 600 milliliters. The rules of flushing and drain care are exactly the same in terms of the stopcock and how to flush. The only difference is that this is not to suction, this is to gravity drainage. The one thing to note about these bags is the bottom port, which you want to make sure is closed when in use.
In this video, we're going to demonstrate how to properly care for and dress and change the dressing on your new drain that you have. So we have a couple items in our pack that you're going to be sent home with. One is going to be some gauze. You're going to use the gauze in conjunction with either a Tegaderm, which is a waterproof plastic piece of dressing, or tape, and we'll send you home with either or both. The best way to dress your drain and to keep it clean is to take gauze and fold it in half. You will then use scissors to cut about halfway from the folded side into the center. Once you have your gauze cut like so, you're going to bring it up under the drain, making sure that all the areas around the drain are covered. You can take a second piece of gauze and fold it into a quarter, in half and in half again, and set this over the top. You can then peel away your Tegaderm for a waterproof dressing. The edges come off around the bottom. For sensitive or thinner skin, we choose usually the perforated tape. This tape is more breathable and adheres to the skin just as well. The only difference is it's not waterproof. With this tape, you can make sections out of the pre-perforation. We typically go about 3 segments long, and you will add the dressing as so. Sometimes it's easier to pre-cut the perforated tape and set segments out on your table or your working space so that you have the sections that you need to cover the entire dressing. Making sure that the dressing has as little wrinkles as possible and is comfortable for whoever's wearing it.